Right, so it's the morning. Today's Thursday, the 3rd of March, 2022. Good morning to you, wherever you are, and warm welcome to our breakfast show. Good morning, Sierra Leone, live on the national broadcast of the SLBC. This program, as usual, starts your day with analysis on different views on issues and events happening around Sierra Leone. I am Victor Jones with you this morning. Our quote for today is from an American actress, singer and dancer, Jennifer Lopez. And it says, doubt is a killer. You just have to know who you are and what you stand for. Coming up in this edition of Good Morning Sierra Leone, month of March is observed by the World Health Organization as Oral Health Month. We shall be finding out what oral health is all about.
Morning to you.
Oral diseases are a major health concern for many countries and can negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation and loss of self-confidence, and they are often linked to other serious health issues. Most oral health conditions are largely preventable and can be treated in their early stages. Well, the month of March has been set aside to educate people about the importance of oral health. But what exactly is this oral health? Good morning and welcome.
Yeah, good morning.
Thanks
for having me.
Indeed, just so we begin, will you kindly introduce yourself to the viewers this morning?
I'm Dr. Ahmed Al-hassan. I'm a dental surgeon, currently working with the Ministry of Health and Sanitation Rural Health Department, posted at Connaught Hospital.
Right, so, Doctor, you are a professional. How can you describe this condition for us? What exactly is it?
All right, so when we say oral health, oral means mouth. Of course, health is, being in a state of, where there is a state of complete physical, mental, and social well-being, not only the absence of disease. So they say oral health basically can just say taking care of the mouth as it is supposed to be. And of course, I'm sure we know a lot of the issues that have been that we are faced with in terms of oral health. The most common one of them is the dental caries, which is the cavity. Of course, we have the bad odor, you have the ulcers, you have the cancer, and a host of them.
There are people with, if I should describe them, like this lens, they appear to have, natural bad breath. Is that correct?
Yes.
Yeah, what's the cause? That's quite famous in Sierra Leone, isn't it?
Yeah, so, technically we call it halitosis.
Halitosis.
Bad breath.
Oh.
And the causes, can be dual faceted. The first aspect is as a result of poor oral hygiene, lack of toothbrushing, lack of flossing. Naturally, due to, when you eat and the food particles settling on the mouth. So when they are not brushed, what happens? It leads to this, the bad breath. And also it could be as a result of systemic conditions, like issues relating to the kidney, issues relating to the liver. It could be as a result of problems in the stomach as well.
Oh.
So it could either be local or systemic. Local, that's as a result of poor oral hygiene, and systemic, that you have issue going on in your body.
Doctor, how can that be solved?
Well, for the local, you just need to encourage the patient to brush their mouth twice a day, especially at night. And there are cases where the patient has been brushing their mouth for a very long time, so you need to see a dentist to help with professional dental cleaning. And whereas for the systemic, you need to identify the cause. What exactly is the cause? Is it a renal disease? Is it a disease with the liver? Is it because something going on in the stomach? So you identify the cause for you to solve it.
Let's discuss preventability. How exactly can one prevent, should I say, dental cavities or most of the conditions you mentioned, doctor?
All right, so for us to understand the prevention, we need to understand the cause. So how does this all come about? From the natural working of our body. you have bacteria in our mouth. So when you eat a sugar, they are there. So when you eat a sugary food,
So
they
all humans have natural bacteria
yes, we have
in their
bacteria
mouth.
in our mouth, all over the body actually, but you have a specific population of them. So when that population increases, it means their action increases. What is their action? The bacteria acts on the food that we eat to create an acid, and it is that acid that demineralizes and destroys the tooth. So this is actually the cause. So for you to prevent it, you need to control the population of the bacteria in the oral cavity. How do you control that population? By brushing. You brush your teeth twice a day, in the morning and at night. And the second thing is, we said, the food. So it means when you eat, you should make sure there are no food remains in your mouth, and you reduce your intake of sugar. So you brush your teeth twice a day. You come for dental checkup at least once a year. You immediately report any dental issues that you have. So at least with these three, it will go a long way to prevent a lot of dental conditions.
Surgeon Specialist Dr. Al-Hassan Ahmed Sharif, continue to stay with us on Good Morning Sierra Leone. We're going for a short break. Right back.
Good morning. Good morning.
Welcome back. You're still on with Good Morning Sierra Leone, live on the national broadcast of the SLBC with me, Victor Jones. I still do have Dr. Al-Hassan Ahmed Sharif, dental surgeon at the Connaught Hospital. It's the only thing we need at this point in the program that we go for our brief health tip. Right. Welcome back. This is Good Morning Sierra Leone from the national broadcast of the SLBC. Now, I still do have Dr. Al-Hassan Ahmed Sharif, dental surgeon at Connaught Hospital. So, doctor, if we are to continue, indeed, it's high time we started discussing harmful health practices, indeed, that might hinder, proper health, dental health, if I should say.
Yeah. So it's one of the exacerbating factors of the dental diseases is the harmful health practices. For example, someone is having a problem in their teeth. They will tell you, okay, you need to you break a medicine and put it there, you need to put relief or you put stop pain. Unfortunately, it actually worsens the situation.
Well,
yes, because you are actually catalyzing the process. So this can lead to dental abscess, it can lead to limbic angina, and in most cases, it could be fatal. There are also people in the habit of, maybe they hit the place up, people can go to maybe to the traditional healers and they heat it up. And heat is one of the factors or one of the conducive factors for this bacteria. So it worsens the situation. So the thing is, you brush your teeth twice a day, especially at night. You have a dental issue, you come to the hospital. The earlier, the better. So you don't go about pepper doctoring the issue because you are only creating more harm than good for the situation.
and how can we raise sufficient awareness around this? It appears that's the issue now at hand, isn't it?
Yes, so when it comes to the oral health awareness, in turn is very low, which is why the department has put down a strategy to create more awareness. One of these is the health education. Like we're having this talk now on the TV, the radio stations. We are going to be going to schools, to marketplaces. We'll be even going to communities where there are no dentists or dental services to provide dental treatment, for them. So that's why the world is celebrating World Oral Health Day. But here in Sierra Leone, we decided to celebrate the World Oral Health Month so as to get the message out, there in a more effective manner for people to know that prevention is better than cure, and of course cheaper than cure.
Doctor, as I round off with you this morning, do you have contact angles that someone can reach you through?
All right. Well, let me give a general one first. As regards to the department, here in Freetown we have three areas. We have the Sykes Dental Clinic. We have as well in Ross Road, and then we have Connaught, and then we have at Poole, we have at Kenema, there is at Cambia, Potloko, as well as Moyamba, and there are plans in place now for us to have in Pujan as well. So these are discussions that are going, and if it's my contact specifically, you can get me on 076 580858, 076 580858.
Right. Doctor, I thank you very much indeed for being on Good Morning Sierra Leone.
All right, thank you very much for having me.
He is Dr. Al-Hassan Ahmed Sharif, dental surgeon attached to the Connaught Hospital.